All right, good morning, everyone, and welcome to the Capacity Building and Child-Specific Funding webinar. My name is Emily Smallson. Again, we are recording today's webinar, and the slides that we will be using to present throughout today's webinar will be shared with you following this webinar. I'll send those out likely later this afternoon or first thing tomorrow morning. You can expect to receive those. If you have any questions or if anything comes up throughout the webinar, if you're experiencing any audio issues or anything, feel free to pop any questions or comments in the chat. And I will keep an eye on just any sort of IT issues. And then if you have any questions pertaining to the content, if time allows at the end, we will answer the questions that we're able to. All right. Okay, so I think on that note, I will hand it over to Diana.
Good morning. My name is Diana Wagner, and I'm a health program specialist with the California Department of Social Services and in the System of Care branch, and have the opportunity to work with the Rates Bureau on capacity building and child-specific funding. And so really just an overview of today's webinar is that we will be discussing the capacity building funding. And we'll do an overview of the funding itself, how to apply, our review process at CDSS. Then I will be turning it over to my friends in Riverside, Bridget and Rachel, who will be talking about their plan that they have actually submitted. And then the Catalyst Center's county and provider support efforts. And then we will turn it over to DHCS, and they are going to talk about the Behavioral Health Infrastructure Program. And they will do an overview of the funding, populations considered for round 4, expansion, grant funding and set-asides, and technical assistance that can be provided. And then we will move into the child-specific funding. And again, we'll do an overview of that funding, how to apply, our review process at CDSS, and then we will be turning it over to Ventura to talk about one of their applications and the process and how it went for them, and how it also supports the youth in their county. So the capacity building funding is a one-time funding that is to be spent over a 5-year period. It is for $43.3 million. And it is connected to All County Letter 41-143. And really the idea of making this funding available to counties is to be used to supplement and not supplant. And really it's an opportunity for counties to take a look at where they have some gaps or some needs within their continuum that need to be addressed. And this funding should be used to support that. And you'll definitely hear that as Riverside talks about their plan. As I said earlier, the funding is available for 5 years. Year 1 has gone at this point, so you have an additional 4 years to spend that money. And the funds are not intended to pay for maintenance costs of an individual child, but really it is to increase that capacity. And it should be an evaluation that is done with your entire system of care team. So if we go to the next slide, when we take a look at the application process, there is a self-evaluation that is to be completed, and that can be found, the link to that can be found in ACL 21-143. And that's an opportunity for each system partner to sit together, either individually and think about the process and then come together and talk about it, or really within an ILT meeting, the interagency leadership team meeting of system of care, to really talk about and walk through that questionnaire. And we have some examples of that a few slides down. So counties submit that survey. From there, they will complete the capacity building proposal that is also, it's attached in ACL 21-143. And there you are identifying from the gaps that were identified from the self-evaluation, how these gaps can be addressed in the plan, and how the funding will contribute to the establishment of just a real high quality continuum. And then of course, it's just a matter of submitting the proposals to the rates policy. At the time that it's submitted, CDSS and DHCS together really take a look at the self-evaluation that has been submitted and look at the proposed plan and the request for the funding and see that it lines up to really build out that continuum that is needed within your county. There may be an opportunity for us as county partners to meet with you as a county ILT and really discuss the plan that you have submitted. This is really a brand new process for us, as we've only had one county, and we did end up meeting with Riverside team and having a discussion around their plan and how they saw it working. And then had a conversation to make sure that all partners within the ILT were a part of that plan. And so that also includes the tribes that are in your county. Counties will also be required to submit data related to the gaps analysis via an Excel spreadsheet template that'll be made available through email. So with the county self-evaluation for capacity building, there are several questions that is included in the survey. However, it really is that opportunity to lead you through, do you have the right placements? Do you have the right services? And do you have the right partners involved in order to address all the needs of the children involved in your county, especially those with complex needs? And so we're really looking for who you are, who's a part of completing this survey, and are all your members included? The next step in the county's self-evaluation for capacity building, Emily, can you forward to the next slide? Thank you. Is really, we're evaluating whether the county has a continuum of settings that can meet the needs for youth that require services in several of these areas. This doesn't include everything, but it takes you through each step of evaluating those youth with complex needs that we often hear about on the technical assistance calls that we hold at CDSS as a part of the system of care team. And so are you able to meet the needs of those youth in your county with commercially sexually exploited, those with substance use, those with co-occurring mental health and SUDS? We often find that that's an area that we don't currently have capacity throughout the state. Also co-occurring mental health and IDD, regional center involved youth, juvenile justice youth. Often on calls, we're talking with probation around youth that have some significant history with law enforcement and within the juvenile justice system that still need a placement. And so there's oftentimes not those settings for them. And also youth identifying as LGBTQ. Next slide. Additionally, looking at questions pertaining to capacity in the continuum and services. So we're taking a look at really STRTPs community treatment facilities, psychiatric health facilities, and psychiatric inpatient hospitals. So do you have enough of a capacity within your county or surrounding areas to address those youth that need those placement settings? Regional center, residential options, respite care, wraparound services, independent living services, Medi-Cal, especially mental health services that meets the intense needs of those youth with complex needs, crisis support services, and then there are several other areas that it goes into. And now I'm going to hand it over to Bridget and Rachel. And Bridget, if you wouldn't mind just talking a little bit about what that self-evaluation and what that process was like for you and your team.
Sounds good. Will do. Thanks, Diana. Okay, Rach, we're on. So thanks everyone for being here. It's so weird to not be able to see everybody. So it's a little funny talking out of screen, but we just wanted to share our experience and as we navigated the process of submitting our plan for part 2 of the complex care funding. If we could go to the next slide. So what we want to talk about, not necessarily going into the nitty-gritty of the data collection and but really just sharing with you kind of from a broad overview perspective that really what we use to help inform us anecdotally, if you will, but then also we did complete the survey that Diana was mentioning, and I'll talk a little bit about that in a minute. But many of us in our counties, you know, with the placement crisis that we have and really seeing that there is a gap in our continuum and trying to build programs around the needs of our youth and meeting those needs, we are really in our county looking to our kiddos where it takes a little longer to find placement. And what is it about that is taking the time to find a placement? What are the needs that aren't being met or that need to be built in order to safely meet the needs of this particular youth? And so we just really paid attention to what those placement needs are and what some of the behaviors are, what you know, is it our IDD population, do we have kiddos that have medical needs, and or a combination of those things, right, in the term that we're using, complex care needs. And it's really about those unmet needs for the youth and just allowing our lived experiences to help inform what's missing. And the other thing too is paying attention. In our county, we have a budget specifically for rate patches. And, you know, so think about those kiddos that they go to an SCRTP, for example, but they could probably benefit from like a 1-to-1 staff or a 2-to-1 staff. We leverage those rate patch dollars. So really also looking at what are we paying rate patches for? If they wanted to provide that as maybe something concrete for counties to take a look at, what are we submitting specialized rate requests for? What are we doing with our rate patches? So that was kind of that data that we're talking about. And then following the ACL, what we did was we, the 3 main agencies, so probation, behavioral health, and us, child welfare in Riverside County, we completed that survey from everybody's unique perspective to help inform what we see that are things that are missing in our continuum of care and what would we like to build out. I don't know if I want to, Rach, if you want to jump in with the shift in probation requirements before we move on.
Yes. So as Bridget said, really our focus within our department has always been rehabilitation, but when we really started to look at our placement population and see that there were growing unique needs for these clients, and Bridget really posed the question to me about, how is this working for you? Do you feel like you have the kind of continuum of care that supports your entire probation population? And ultimately, the answer was no. And when we began to look at why was our answer no, and Bridget and I kind of laughed about this earlier when we talked of these cases make themselves very well known to you. They are not hidden, they are not hard to find. They are the youth that for us languish in detention longer than you would like because you are just having a hard time finding the right fit. So really, I want to emphasize the importance of the partnership. As we as a department wanted to focus on how can we really build a path for all of our youth to better rehabilitation. That path also included a collaboration, as Bridget mentioned, with not only behavioral health, but with our social service partners. And so as our shift began happening, as Bridget mentioned, we had these ongoing meetings and conversations around certain clients. Many of them were dual jurisdiction youth. And as the out-of-state decertification transpired, we leveraged the expedited treatment services with Uplift and Seneca, and continued to have conversations about, wow, here are these other opportunities to utilize other partners to help support that that complex care need that we have for our youth, and kind of off we went. And I'll say, really having a partner like Bridget, having someone that really has the vision. Sometimes as you make your way through your career, the decision making can become convoluted. We're looking at volume of need. We're looking at how to really handle the largest part of our population. But really, the partnership with Bridget was talking about not only how do we take care of the youth who have more standardized needs that can be met in SRTB, but also how can we meet the needs of this maybe smaller population as well. And so I can't emphasize enough the importance of really having that partner that you can reach across the aisle, and you can join forces together in really trying to figure out how to solve that complex care need issue that you may be up against.
Thank you, Rachel. So, so one of the things that we didn't do, and we are circling back, to go back to our ILT, our interagency leadership team. And so, as I said, the three primary entities that completed the survey that's referenced in the ACL, Diana mentioned, was our three main agencies, being child welfare, probation, and behavioral health. And so what we're doing at our next ILT meeting is circling back to the group and sharing how we landed where we landed based on our assessments and what we see in our offices on a daily basis of the types of kiddos that are needing placements that we don't quite have the program designed to meet their specific and unique needs. So we're going to be circling back to our ILT, and any amendments or changes that result from that, we are going to resubmit to the state as needed. So we are circling back to do that. So lesson learned from us is the counties that are out there listening, definitely encourage the different agencies through your ILT to take a look at the survey or take a look at the draft plan and provide any input prior to submitting to the state. And through that survey, we were really able to identify the things that are needed in our county. And so I'll share a little bit about what some of those things are. We definitely saw the need for what we call a welcome center, or, you know, an emergency shelter, if you will, and really just needing a safe space and place for a kiddo to land while we engage the kiddo and different providers to do a real complete assessment about what would be beneficial and to engage the youth in, you know, in your last placement, if it's a replacement or a new placement, you know, what are some of the things, for example, if you have a kiddo who deals with anxiety by cutting themselves, right? What creates that anxiety? And just hearing from the youth about, well, really, if there's too much chaos happening. So thinking about, you know, what type of placement setting would work best for that youth, and just having the time to be able to engage in those needed conversations as well as complete those needed assessments. So we're really making an informed decision, a thoughtful decision, and doing a placement match rather than finding an empty bed for a kiddo. And that's really what we're looking for. So for us, that was a need that was identified, as well as the STRTP of one's enhanced ISFC through our expedited transition services that Rachel mentioned, that we utilized in bringing back our youth from out of state. We developed some good partnerships with some of our agencies and created an enhanced ISFC home for a kiddo where, I mean, honestly, for my director down to my managers and supervisor and worker, you know, we were just kind of waiting for that call that something really bad happened to this kiddo, chronic AWOLing, some concern about possible trafficking, medical issues, significant diabetes, that was insulin dependent and continued to run from placements, wouldn't go to any placement. And so it was just a real struggle. And, you know, one of our agencies talked about harm reduction. And really that's what we've been leveraging. And thankfully, this kiddo has been in the same place since February of last year. It's a home-based setting, you know, with those added supports, but those things take time to build. But we're seeing success in that, you know, we know where the kiddo is, and they may not be participating in therapy all the time and those kinds of things, but at least, you know, we know where they are, and we are working towards kind of that harm reduction, if you will. The other thing was small family homes, a need for more of those, particularly around our medical needs as well as our IDD population. So those were kind of, I think, the main things that stood out for us. We were, what also helped inform that was probation and child welfare. We had a kiddo, we have dual status in our county, and we had a kiddo that we were able to create an STRTP of one, and that kiddo just graduated from high school earlier this month. So to be able to partner together in that way and, you know, figure out all the funding stuff. I don't want to say, especially because this is being recorded, that money isn't an issue. However, one of the things that Rachel and I talk about all the time is we'll figure out the funding, but that should not stand in the way of the kiddo getting the service that they need. And so for all of us to really have that inherent value and belief, I think is beneficial as well. So all of that really helped feed into not just the survey itself. So what I would encourage our county partners today is, yes, you want to utilize that survey, but don't forget about the lived experience and incorporate both what you see as your placement struggles today and what would it take or what would be nice to have based on that, as well as the information from the survey. I think you need both to help inform the plan. And yep, next slide, thank you. So, oh, no, go back. Thank you. So funding the full plan, and I saw a question from Martin in Orange County in the chat. So I was trying to type, but typing and talking at the same time is not working for me. So I'm glad you brought that up, because I was going to address it in this slide. Is, you know, through our work with expedited services and partnering, we reached out to one of our providers and said, looked at some of the work that they were doing in other counties and said, what would a full continuum look like? We know we need, you know, STRTP of 1 and you know, everything in between. What would that look like? And they were able to put something together for us that really gave us an idea of what it would cost. And I think, don't quote me on it, but I think it's roughly, to include like a welcome center all the way to like a crisis stabilization center or an STRTP of 1, you're really looking at about $18 million. And obviously the allocations is not going to meet that, which is why we need support, you know, from mental health. And they've been really good about establishing contracts with some of our providers that are doing the STRTP of 1s, providing expedited services. And so we have a good partnership with our local mental health plan, that you're going to need to leverage a lot of different funding. And I don't know that there is enough funding to go around. So for our purpose and our perspective, even though our allocation, you know, was X amount of dollars and our full plan really exceeds that, we felt it was important to submit the whole enchilada, so to speak, because I think it's important to paint the picture and provide the full context of what it is that you're trying to do in your county. So I would say, to the question in the chat about prioritizing and, you know, how do you prioritize what you submit in your plan? I would submit your full continuum, so that way it provides a good picture of what you need in your county to be able to truly meet the needs of the kiddos and families in your county. Even if that exceeds what that allocation is, I still think it's important to provide the big picture. And I think next slide. And so we said this a little earlier as well, is, you know, a lesson learned from us is, I think in our county, we're so used to it being the three of us, you know, kind of the big three, so to speak. But probation, behavioral health, and child welfare, we try to meet regularly together and just talk about what each of us are doing. But we don't want to forget about our other partners, our education partners, our regional center partners, our tribal partners. And so just making sure that you're getting the voice of those other external partners to help inform that plan, even if that means, you know, you're kind of putting it together and sharing the draft with them, but making sure that there's some review and input into your plan prior to submitting, because you definitely need their support in a variety of ways, whether it's through braided funding or whatnot. So it's really important to grab them at the onset. I don't know, Rachel, if you would add anything else, if I've missed anything.
You know, Bridget, we had talked about, back to the slide before that, about ensuring that you're leveraging the other funding. As you know, your behavioral health partners, right, have access to the additional funding that maybe you as a probation department, right, our funding sometimes is limited when it comes to not only care for foster youth, but also those with higher levels of need. And what we found when Bridget and I were looking at this population is there was quite often a nexus with either developmental issues, medical issues, and behavioral health issues. So making sure that As Diana pointed out, this was not meant to supplant your funding. It was meant to supplement it, that you really are creating those partnerships so that the other funding streams can be leveraged and being creative in the way that you go about that. When we looked at the full plan that was submitted, sat down with Bridget and looked at it, there were pieces of it that were beneficial to our department, but when we looked at our entire placement population and then this cross section that maybe have these additional needs, we realized that our partnership may look a little different than the partnership that they are having with behavioral health, and not being afraid to have those conversations, and back to really even the self-evaluation. If you're not sure as a county, where you would utilize this funding, I had mentioned, it was very clear for us through the anecdotal cases, right? These were the kids that were hard to place, that were languishing either in juvenile hall or our social service partners were really having a hard time finding placement. The great part about the self-evaluation is that it gives you an idea, if you don't already know, of what those populations are. The questions are very intuitive, and really our partnerships, not only with each other, but even internally with our placement coordinators, those that are kind of the boots on the ground, that was so helpful to kind of glean some of that information and utilize them in the completion of that self-evaluation.
Thank you. And turning it over to our Catalyst partner. We can't hear you, Alex, if you're talking.
I didn't unmute myself. Thanks,
Start
Bridge.
over. You're welcome.
Thanks. I'm Alex Volpe, Program Director at the Catalyst Center, and I'm just going to talk a little bit about some of the supports that the Catalyst Center can provide with these efforts. And we've definitely done a lot of work as well with Riverside, and very impressed with the continuum of care that you all have put into place, Bridge and Rachel and team. So the Catalyst Center can provide training and technical assistance in a variety of areas. A few of them are listed here: wraparound, family finding and engagement, as well as individualized and trauma-informed services. We're also able to help folks think through partnerships. So Bridge mentioned some of these, partnering with Regional Center, thinking through with our educational partners, to really try to access all of the resources that providers and counties can leverage. And then also, in particular, provide technical assistance and support for youth with unmet complex needs. So that could look like support for an individual youth with unmet complex needs, but also really expanding the continuum. So we've talked a lot about STRTPs of 1 and enhanced ISFCs, and in general enhanced care programs. So the Catalyst can really support counties and providers with thinking through what might the gaps be in your current continuum of care, and how we might be able to support those efforts in building out more enhanced care programs for youth with unmet complex needs. So we have a variety of tools. We can do presentations to sort of orient folks to what's working on the ground right now, because we are collaborating with a number of folks that are here on the call today to set up these enhanced care programs. And I will put our email address in the chat so that folks can reach out if they're interested in any of these services and in learning more. Thanks.
Thank you, Alex. And when we send out the PowerPoint slides after today's presentation, I'll also make sure that email is in there so everyone has it.
Thanks.
Thank you so much.
Hi, good morning. I'm Marlise Perez, and I'm with the Department of Healthcare Services. And I was asked today to just briefly present a little bit about our Behavioral Health Continuum Infrastructure Program, known as BCHIP. hopefully you all have heard about it, and if not, this will just give you a good introduction, and then I'll help you find out where to get more information. Next slide, please. So what we commonly refer to as BCHIP has some guiding principles and priorities. We are also rolling out this funding along with our partners at DSS with the Community Care Expansion Project. And so really it's, investing this administration in behavioral health and community care options. And so we're super excited about this funding. We want to, we're looking at geographic equity as the funding is being awarded, really looking at those urgent gaps across California. Also with, looking at specific gaps, and I'll talk a little bit more about how we're identifying those. And you'll see here just really looking across the spectrum of, creating more facilities, more expansion for individuals with behavioral health needs. And so also as we're looking at that is what types of, there's certain places that our folks end up that we really want to break that cycle, and some of that is incarceration, hospitalization, homelessness, institutionalization. So you'll see a lot of the efforts as we roll this out are focusing on that community care. Next slide, please. And then more guiding principles here, but we're really, once again, also looking at vulnerable populations, children and youth being one of them, also justice involved. We really want to have that care at that least restrictive setting, like I already mentioned. We're also looking at how our applicants are leveraging county and Medi-Cal investments, and then also looking at how they may be leveraging investments in housing and homelessness. Next slide, please. So what we did is we put together, as I hope most of you have already seen this, we have the behavioral health needs assessment here, and the link is provided down below. So if you haven't had a chance to check that out, I'd encourage you to look at that. This was a assessment that DHCS put together along with our partners at the county and the local level, and you'll see we looked at all of the facilities across the behavioral health continuum to see where we have gaps. Next slide, please. So one of the uses of this needs assessment was to help inform our BCHIP efforts. You'll see here just some general statistics that won't be surprising to you, but some of the key gaps that we found across the behavioral health system. And that's really helping us inform not only how we are rolling out the BCHIP dollars, but also the applicants that will be accepted as grantees. Next slide, please. So BCHIP, it passed in this last year's budget. It's a total of $2.1 billion in funds that will be re-granted out to the grantees. And right here is a link to the Welfare and Institution Code. So I would encourage you, if you haven't read through that, that gives you basic framework around the parameters for BCHIP. But basically, it is competitive grants that, depending on which round it is, but the funding is for counties, tribal entities, nonprofits, and for-profit entities. And this is to build new or expand existing capacity. This is a really key point. This money is not for preserving current facilities or current capacity. So any grantee that's going to be awarded funding has to show and demonstrate that this is for expansion of capacity. And once again, this is only for actual bricks and mortar. This is not for behavioral health services. These are to build facilities. Next slide, please. So we are doing multiple rounds of funding, like I already mentioned. We've already actually rolled out 3 of our rounds. The first round was for mobile crisis, and that was geared just to counties and tribal entities. Our second was a planning grant phase, just once again for our county and tribal partners. And then round 3 is for launch ready, and we're just about ready to make those announcements. So if you have applied, I know you're very interested to see if you've been selected. We received over about $2 billion in applications just for that round. We will be awarding a little over $518 million for round 3. And so, like I already mentioned, each round has a different focus. Next slide, please. And so our round 4, which is, I know you all should be very interested in, is children and youth. I do want to state while round 4 is dedicated to children and youth, that doesn't mean that this won't be a population of focus in other rounds as well. But this whole round is dedicated only to facilities that serve children and youth. So in this round of funding, we'll be awarding $480.5 million. And once again, this is to expand access only. There is no preservation funding involved. So this is for facilities that are serving kids that are ages 25 and younger. Next slide, please. And so these are the populations when we talk about children and youth 25 and younger. So perinatal, children, transition age youth, and family-based services. Next slide, please. So these are the potential eligible facilities, meaning that just these facility types may apply. And so once again, even some of these facility types may also serve other populations, but we will only be providing funding to expand services for that group of 25 and younger. Next slide, please. There is a match that's required in all of the rounds. And so this match for round 4 is the same as round 3. And so matching funds can either be in the form of cash, and we have a list of different types of funding sources that can be utilized, or it can also come as real property. So you'll see here different entity types have a different match requirement, but services will not be allowed as a match. Next slide. And then also what we're doing is we're following the same format that we did in round 3, where we are breaking out the funding that is available, and we are grouping it in regions. And that doesn't mean that it is per se an allocation for that region, but it is a gauge for us at the state level to ensure geographic equity across the state. In that, we also reserve 20% for the state to kind of place ourselves, and then there's a 5% of funds that is dedicated to tribes. That is, of course, if we receive enough eligible applicants for that 5%. Next slide. So we have a tremendous amount of technical assistance. And so if you are an entity that maybe is considering applying, or maybe you have a regional collaborative or something or anything along those lines, you can receive technical assistance, and it's already available for round 4. You can put in a survey right at our website that will give you what's called a pre-application consultation. You can have as many of those as you'd like, and that is really just to try to help you get ready for submitting your application, answering any sort of questions. We are rolling out FAQs. We have FAQs from round 3 that'll help gauge as well. But so there's a lot of just technical assistance available. We have a lot of videos that are posted as well. If maybe you're more from the program lens and not so much in the construction lens, we have some technical assistance available for you as well. So please feel free to reach out for that assistance. Next slide. And with that, this is the main web page here that you can go to for all the information that I've been discussing today. You can also see for those rounds that we've already rolled out, who was awarded. You can learn more about our round 3 awards that will be coming out, like I said, in June, so over the next few weeks, but all of that will be posted as well. And you can learn also the RFA for round 4 is already posted. It is live now, and the due date on that is August 31st. So if you're interested in submitting an application for round 4, I would really encourage you to get a pre-application consultation meeting going, so you can start talking just about, your project and any questions you may have. And with that, I will turn it back over to our partners at DSS.
Thank you so much, Marlise. And again, to everyone, I'll make sure that this email is listed in the resources that go out when we send out the PowerPoint. Does anyone have any questions about the BCHIP funding in particular? Marlise unfortunately does have a conflict at 10 a.m., but she was kind enough to join us while she could. So if anyone has any questions about this in particular, we can try to get those answered in the last few minutes that she's still on. And Diana, I think some questions might be coming in to the host. I'm sorry, to the presenters, not to the host and the presenters. So if you're seeing any that I'm not, feel free to just read those. Okay, well,
I'm only seeing that folks want the different email addresses and websites that were referenced. So,
okay, then I think we'll go ahead and move on. Thank you again so much, Marlise, for joining us this morning and sharing that information. And again, once we do share these PowerPoints out, I'll make sure that all of the implementation guidance that's referenced and all of the emails and all of the websites that have been referred to and shared are all kind of hyperlinked within the body of the email that I send out. All right, I think we'll go ahead and proceed.
okay, so now we will go ahead and talk about child-specific funding, and that is the $18.1 million, and additional information can be found in All County Letter 21-119. And this funding is actually ongoing funding as long as it's available to us for counties, and there's an allocation that is attached to the fiscal letter for 21-119. And really what the intent is to address the urgent needs of children with complex needs. And this again is funding that is made to not to supplant, but to add to the costs that may be associated with ensuring that the children's needs are being met. And so we will have Ventura share an example of how they've used this funding before. If you were at the CPOC conference, you got to hear from LA County and how they were able to use this funding to meet the needs of one of their very complex youth in order to ensure that her mental health and her safety was secure. The funding is available to county placing agencies and also 4E5s to really support those high acuity needs of the children. The request must be based upon recommendations of a behavioral health assessment, a qualified individual. It can come from a technical assistance call with CDSS or other clinical recommendations that are approved from the CFT or even the Interagency Placement Committee. Next slide. So the technical requirements is that there is a template and invoice that must be signed by the child welfare program manager, administrator, or director, or probation chief. There's been a few that we have received that didn't have a signature, and so some of the lag time was just a matter of obtaining that signature. The $18.1 million, they have been allocated to counties as shared earlier. The claiming can be claimed retroactively back to July 1 of 2021. And again, this is not to be used to supplant existing funding. So the process is that you're going to complete a child-specific funding template. If the questions don't apply to the child that you are requesting funding for, you can write NA. And also, if some of the questions are answered within a assessment or qualified individual assessment, you can attach that assessment to the form and submit that. So you do not have to replicate the information onto the specific plan. Next slide, please. Once you have completed, you're submitting the child-specific funding template and any attachments to rates policy. And just note that no payments can be made until an invoice is received. And that's after the end of the fiscal quarter. If it's an ongoing payment, and then after the services is rendered for a one-time payment. Next slide. So really, once you applied, we have streamlined this process significantly, and really within a 48-hour period, if everything is submitted and the form is signed, we are getting back to you within your county with that approval. Once it's approved, an approval letter will be mailed to the child welfare director, probation chief, or 4E tribe leader, and then an email copy will be sent to the contact person. CDSS, we are committed to completing this process quickly, and what we ask is that there may be some follow-up questions, and so making yourself available, we can jump on a quick call and have a conversation that may be 15, 30 minutes long. We can get things answered and we can get that approval completed quickly for you. So now I'm going to turn it over to Ventura to talk about their child-specific funding request that they asked. Joanna?
Good morning. Can you hear me?
Yes.
Okay. I'll talk quickly about the requests that we've submitted. We've submitted 3 so far. And the first one that we did was in support of a youth who had been at college hospital for quite a while, a few months actually, on admin days. And so we were eager to get that particular youth into a placement, and we're struggling with the regional center. Because the youth was in LA and our regional center in Ventura County, there was some coordination for that funding. And so what we were able to do with the child-specific funding was to go ahead and move forward with the placement at the regional center home that was identified, which allowed them to go ahead and take placement prior to that funding being secured by the regional center. Ultimately, it was secured and we didn't end up having to use the child-specific funding, but just having that funding available and ready for approval helped us move forward on that placement. We had an additional request. It was a resource family home who was in need of some one-to-one for a youth placed in his home. And so we were able to secure the child-specific funding for that placement as well. It did, Diana mentioned, having some additional questions and have it, the discussion with CDSS regarding what the request was and what the need was. And so we were able to do that rather quickly and get that funding approved for that particular placement. And then our third request was for a youth who is in an STRTP placement, and they were in need of additional one-to-one for that youth. Was a difficult to place youth, lots of runaway, lots of additional needs for that particular youth. And so we were able to secure the child-specific funding for that youth as well. We're actually getting to the end of this quarter, so we'll be submitting our first invoices. And so looking forward to seeing how those next steps go with the actual invoicing piece. So, and that's pretty much it so far. I would say that with rates and funding, I have reached out to them a few times to find out if a particular situation met the child-specific funding, and they have been very gracious about supporting us in those requests, because the application process or the application itself is kind of cumbersome, and we don't necessarily want to have our caseworker or social worker go through those steps of completing the application if it's not something that's even going to be viable. So they've been really helpful with that as well. And I guess lastly, I'll just say that our requests, when we have submitted them, like Diana said, the turnaround is very quick. I would say a couple days on one of them at least. And then the one that we had to, meet on took a little bit longer, but not, I think it was like within a week's time to accommodate that meeting. So yeah, it's been pretty helpful. So thank you.
So some additional resources that are being currently developed by CDSS and partners is Innovative Models of Care Resource Guide. We are currently in the process of drafting this guide. The guide will then go through the internal approval process, and we are looking to release that by August of this year. We will have a complex care landing page, and it will include resource guide that we just talked about, the innovative models care, webinar recordings, information on upcoming meetings and webinars. And we are looking to go live actually this month. So be looking for that. If you would like to receive a link to one or both of these things, they can become available. Once they become available, please email Emily. And if you have any requests for additional topics for the resource guide, please also contact Emily with any additional resources you want to see. So we do have some time for some questions. And Bridget and Rachel, are you still on?
Yes.
So we do have a question. How long did it take for Riverside County to receive the complex care funding once their plan was submitted? Do you want to talk a little bit about where you're at in that process?
Bridget, your sound is not working.
There we go. Am I good now?
Yes.
Okay. I was actually going to text you, Diana, like, did we get the allocation? I'm not really sure. So I think where we are, so, bear with us because it is new, and being the first county, you're the guinea pig. So because we are still circling back to our ILT, I believe where we are is that once we do that, and if we're going to make any amendments or modifications, we would resubmit, and then it would be shortly thereafter. In our meeting that we had with CDSS to talk about the plan, there was definitely the support of the plan, and we received really good feedback of what we included and what we wrote about in kind of our assessment. So I think it's probably more of a formality at this point, just to make sure there's not anything else that we want to edit, and then it would be there shortly thereafter. Would that be accurate, Diana, you think? Okay.
This is Ty Morgan. I just wanted to add that we also asked that you work with your tribes. So I don't know if you guys had had a chance to do that, but for anybody else thinking about submitting a request, please include your tribes in those processes.
And I think the thing that I would add, and Rachel and Bridget, please, correct me, is in the process of us having the discussion that we had, your plan has many services and supports and placement settings throughout that continuum plan that was submitted. And so in that effort, there is the piece of talking with system partners to determine how the funding can be leveraged and what funding can be matched. in order to ensure that the funding can go as far as possible to serve the children and families within your community. And so that's part of the reason that we asked the Marlise with DHCS to come and talk about the Behavioral Health Continuum Infrastructure Program, because there may be an opportunity for placing agencies to have conversations with their MHP about what that can look like if they were to work together. And how could the funding from DHCS really build out some infrastructure, and then this capacity building funding could really add to the programming pieces. So just some things to continue to have conversations at that local level with your interagency leadership team.
Yeah, actually, our behavioral health partner, she couldn't join us. She had an all-staff meeting that had been scheduled, and anyone that holds an all-staff meeting knows how much time and energy and planning goes into that. So, but she actually utilized our continuum of care plan, including the services as well as placement options, to help inform how they're going to utilize some of the infrastructure dollars. And so they're looking at building things such as recovery villages, not only for adults, but to have a children's component in there that kind of is like a village of services, if you will. So really looking at how they can support, some of the needs, our substance abuse outpatient as well as inpatient treatment for our adolescent youth. And so just a lot of different options based on our full continuum of care plan that we'll be able to leverage as well. So that's how they've helped inform. So the meetings that she attends through her behavioral health network, she's attending through that lens and through that perspective, and being armed, if you will, with the plan that we're trying to build for placement for the kiddos in our county. So I see a question in the chat around when we submitted our plan. So it was in March, I believe, maybe early to mid-March.
And then Rebecca McGill, the question about the $18 million for an STRTP of 1, it actually, the plan in totality is for $18 million. It has many components to it. It is not just specific to STRTP of 1. And as far as the budget analysis, really, when you determine the path that your agency needs to take, and if you aren't building that yourself, that whoever partners with you will likely be able to provide you that budget analysis for what services you're looking for.
Thank you, Rachel.
Thanks for highlighting that, Rachel, because it really, the provider that submitted what a continuum of care would look like, they also included a budget with that. So it made it really easy for us to kind of look through it too, because that's one of the questions that people, often have is, and that was quite frankly our question, like, we know what it is that we want to build. We know how to build it in terms of you're only going to do it through all your partnerships, but really not understanding the cost, I think. And so having that was definitely beneficial. So I would lean into your provider agencies to give you some budget proposals.
And Bridget, did you and Rachel, did you see the question about how did you choose an FFA?
I don't know that we necessarily chose an FFA. We worked with a provider doing our expedited services, and they had shared some of the work that they were doing in some of the other counties, and just kind of shared a proposal. And so we're really using that as our sounding board. However, it's going to take many providers, many STRTPs, many FFAs. So it's not just an agency, if you will. There's too much work for any one agency, any one child welfare agency, behavioral health agency, FFA, STRTP. There's the need is higher than what any one agency can support. So the conversations that we're having are around, we need enhanced ISFC homes and connecting partners together with FFAs who are doing that, so they begin to learn and understand, well, what would that take and how might they recruit for that? So we're definitely not putting, you know, you don't want to put all your eggs in one basket, so to speak, but it's really about how can we create this consortium of providers within our county that would have a cluster of enhanced ISFC homes or ISFC plus homes, STRTP of ones that are available for us to leverage and utilize. So I hope that makes sense.
It does, thank you. And I think I have a few questions that have just come into me as the hosts. So Rachel and Bridget, someone asked, Riverside capacity building proposal, did child welfare and probation combine their funds and submit one proposal?
Yes, we submitted one proposal.
Awesome, thank you.
And the idea for that, Emily, if I might add, and Rachel may chime in as well, is she was talking about it when during our portion of the presentation that, for example, our need for a welcome center is not the same for probation, right? So we have this kind of shared understanding and agreement that there's portions of the continuum that aren't necessarily a need for probation because of other services and programs that they may have. But it was a joint submission.
Right. And then when we met with the state to go over the application, one of the questions we asked was, how does the state need us to demonstrate that each respective department is utilizing that funding for servicing each of our separate need? And they are working through the details and direction on that.
Awesome, thank you. Okay, shifting over to the child-specific funding. Diana, someone asked, is the current allocation for the child-specific funding usable after June 30th, or will there be a new allocation?
That's a
Yeah,
tie.
as of July 1 of 2022, there will be a new allocation. It should be in the same range as your current allocation. And there is no plan at this point to roll over that funding from 21-22 into 22-23.
Great, thank you.
Ty, did you want to say something?
That's what I was going to say. Our fiscal folks have told us that we can't roll it over. So unfortunately, if you didn't spend it.
Thanks, Ty. Thanks, Diana. Okay, and then another question was, and I think this was, this came in when you were covering the application process for the child-specific funding. If something applies to several domains, we just need to complete it once, correct?
Is that for the child-specific?
Correct, yes.
Yes, you would only need to submit one plan per child.
Thank you. Okay, that concludes the questions that came in just to me as the presenter. Diana, are you seeing any that went into the host that we haven't discussed yet?
I am not, but my Q&A keeps bouncing around, so I'm trying to track it all. I think really one of the reasons we wanted to make sure that we had this webinar is to encourage folks to, number one, sit down with your interagency leadership team as part of the system of care and really talk about what are the gaps in your continuum currently and what can be built to address the needs within your county and community. And then for child specific it's really about ensuring that all systems involved in that child's life are working together, because this funding will go further as you're able to match funds and leverage funds. And those are things that we're happy to sit down and have a conversation with you if you have any questions about that or how that can work. And you can email the rates policy if you have any questions. And I did put their email address into the chat. So please, if you run into a situation where you're not sure how to answer a question, reach out to us. We want to assist you. We want you to be able to use all this funding that's available to you to ensure that you're able to meet the needs of the children within your county. And we'd like to make this process as simple as possible for you. So we're happy to walk you through that.
Yes, absolutely. Thank you, Diana. All right, well, if anyone wants to enter in any last minute questions or anything that's kind of lingering, please feel free to do so. We'll give it another maybe minute or so to speak to any questions that come in. But if not, we'll wrap up a little bit early today. And again, I will share out these PowerPoint slides. Today's recording will be made available on the Department of Social Services YouTube page once we've made it accessible. That usually takes about a week. I'm hoping that that link can go live probably next Tuesday or Wednesday. If anyone would like to receive that link as soon as it does go live, just let me know. My email is in the PowerPoint and I'll be emailing everyone after this webinar with those slides. So just reply to me and let me know that you would like the link to that webinar, and I'll be sure to send it out to you once it's ready. Okay, I'm not seeing any remaining questions. So thank you so much to all of our panelists today. And again, the email addresses that are listed in the PowerPoint, please reach out at any point if you have any questions. You can always reach out to me too. I'll make sure we get you connected with the right people. All right, but thank you so much.
Thank you.
Thanks, everyone.